So, insertion of indwelling catheter for male patients. For the assessment, so assess the type of catheterization that is ordered by the doctor, if it is straight catheter or an indwelling catheter. Next is to assess the status of the bladder. If the patient feels pain while urinating, or there is a difficulty in urinating, or there is a urinary frequency and urgency. Abnormalities on genitalia or prostate, if there is an enlargement, especially the prostate, and if there are presence of infection in the genitalia. Patient's medical history, so if the patient has history of UTI or there is a history of renal calculi. Allergy to iodine-based antiseptics, so if the patient has allergy to seafoods, most definitely he has definitely to iodine-based. Equipment needed for the insertion of Foley catheter. So urethral catheter set. This includes sterile gloves, cotton balls, pre-filled saline syringe, fenestrated drape, iodine antiseptic solution, another drape, sterile forceps, lubricating jelly, collecting bag, and Foley catheter with collection tube, and specimen container. Next is basin of warm water, washcloth, tape, non-sterile gloves, commercial tube holder, bedpan.
For the procedure, first is to prepare the equipment needed. Next is to perform hand hygiene. Explain the
Hello po
procedure
sir,
to the
magandang
client.
araw. Ako po si Nurse Jed, ang inyong pong nurse ngayong araw na ito. Pwede kong malaman kung anong pangalan po ninyo? Sir Talong. So Sir Talong, ang gagawin po natin ngayon ay maglalagay po tayo ng Foley catheter sa inyo. So dito po is maglalagay po tayo ng Foley catheter sa inyo pong are para po malaman po natin o ma-measure po natin yung inyo pong urine output or yung ihi po ninyo at the same time para po makatulong ito sa inyo po mga pag-ihi. So, ayun po, meron po ba kayong mga karagdagan tanong sa ating gagawin po ngayon? Wala naman po. So, meron po ba mga allergy ah, sa seafoods or sa mga isda or sa mga hipon, ganyan? Wala naman po. O, sige po.
Don non-sterile gloves. Using soap, water, and washcloth, perform genital care to the patient. Remove non-sterile gloves. Perform hand hygiene. Next is to open the catheter set. To set up the sterile field, put the sterile drape on the bedside of the patient. Next is to open the equipment and set it up on the sterile field. Next is to don sterile gloves. So check the patency of the Foley catheter by injecting 2 to 3 cc of sterile water to the Foley catheter. If there is a leakage on the tip of the Foley catheter, so discard the Foley catheter and replace it with a new one. Put iodine-based antiseptic on patient's genitalia. Insert fenestrated drape. Put lubricating jelly on the patient's genitalia. At a 90-degree angle of the patient's genitalia, insert the indwelling Foley catheter. Connect the tube and the collecting bag to the Foley catheter. Secure the tube and the Foley catheter with the commercial tube holder if available. If not, use medical tape. Remove the fenestrated drape. Discard all unnecessary equipment. Remove sterile gloves. Perform hand hygiene. Dispose all used equipment to proper receptacle.
So for documentation, so what are the type of catheterization that is ordered by the doctor, the size of the catheter, assessment of the genitalia. So Note if there are presence of abnormalities that is assessed or seen in the genitalia. Amount of urine output, difficulties encountered if there are any obstruction in passing the catheter smoothly, report for unusual discomfort during insertion, obtain urine specimen for culture. So first is assessment. So assess the length of time the catheter has been in place and maximum length of time before the catheter removal or the change of catheter. Order, doctor's order for catheter removal and parameter for the removal. Client's knowledge of catheter removal procedure. Assess also for the size of catheter in the balloon, the characteristic of the urine, especially the color, the clarity, the odor, amount, and if there is a presence of blood. Amount of urine output, that should be around 40 to 60 ml per hour, which is the average urine output, but actually it depends on the weight of the patient. Presence of pain, distension, or tenderness on lower abdomen. The equipment needed for removal of the indwelling catheter. First is the syringe, graduated container, non-sterile gloves, basin of warm water, soap, washcloth, linen saver.
Prepare all equipment needed. Next is to perform hand hygiene.
So, magandang araw po. Ako po si Jed, and nurse po ninyo ngayong araw. And ngayon, tinatanggalin na po natin yung ito for the catheter. So, ano yung pakaramdam po ninyo? Medyo masakit po. Ayun. So, ngayon po, tatanggalin lang po natin. So, habang natanggal ko po yung for the catheter is hinga po kayo ng malalim para po hindi po siya nararamdaman yung hindi po komportable na pakaramdam ko habang natanggal ko yung balik ate. So, sumalanap na natin.
Don non-sterile gloves. Deflate the balloon of the Foley catheter by aspirating the equal amount of fluids that is inserted to the Foley catheter. Carefully remove the indwelling catheter. Discard the catheter in the urine bag. Adjust patient position to his comfortability. Remove the non-sterile gloves. Perform hand hygiene
discard, and dispose all used equipment to the proper receptacle.
For documentation, so document the assessment of the lower abdomen before the removal of the catheter. Document the assessment of the genitalia and the possible note. Document the assessed genital. Next is to document the assessment of the genitalia and note for any abnormalities if there are any. Document for the size of the catheter, the amount, color, and consistency of urine draining in the urine, any difficulties encountered when removing the catheter, report of unusual discomfort during the removal, status of catheter, time and amount of first voiding, and the specimen obtained, especially the catheter tube that was sent to the laboratory.